October is Breast Cancer Awareness Month, and for decades, women have heard about the importance of doing those monthly self-exam checks as a way to detect any early signs of breast cancer. We're getting some more details now from Dr. Sabna Kubchandani. She's an oncologist with the Hartford Healthcare Cancer Institute in Waterford. Thank you for joining us, doctor.
Thank you so much for having me.
So just to go back to the basics, what would be a self-breast exam?
So self-breast exam, I think of it as a breast self-awareness, is getting to know your own breast, knowing how it feels like. This is something that a woman can do at home. They get to know how your breast looks, what it feels like, and that's a self-exam.
And how often should we be doing those?
Usually monthly. For premenopausal women, it is recommended that they do a self-exam about 7 days after their monthly cycle. And for women who have gone through menopause, they should select a date and a time that works for them, in the 1st of the month or the 15th of the month, and they can do that monthly.
And what are the most common ways to actually perform an effective self-breast exam?
So it usually starts off with an inspection. Is in the front of the mirror, put your hands on the sides, just look at your breast, make sure they're symmetrical, make sure there are no abnormalities that are seen, make sure there are no lumps, nothing abnormalities are standing out. Following the inspection, it starts with, you examine your breast, you can do it in a lying position, you can do it in the shower. You have to develop a pattern that works for you, and do not rush through it. Just check the whole breast out, go underneath the armpits, check that out, and make sure that you're covering each part of the breast.
All right, and so lastly, any general tips to keep in mind as women are doing this?
So you have to remember that this is not the be-all and end-of all. You still have to get all your screening mammograms. It does not replace a screening mammogram. This is something that as physicians, we do recommend, because we like our patients knowing what their breasts feel like and look like, so that if they feel any changes, they can call us and we can see them and figure things out from then on.
All right, and just real quick, because people always wonder, what age do you start getting the mammogram?
At the age of 40.
40 and above, and earlier if you have history. Yeah, all right. Thank you, doctor. I want to encourage everyone, if you don't have a mammogram on the books and you know you need one, please visit hartfordhealthcare.org/breast cancer. Make sure you get those screenings scheduled and do the self-exams at home.